So today we're talking about back problems. And I know it's a thing that plagues us all. Our world's in front of us. We're always bending forward. We're always sitting in chairs. So inevitably you're going to throw your back out. So today we're talking about how you respond to that instead of react in a way where you're letting body kind of fall into this pattern of injury. Instead, I'm going to show you how to take control and how to regain your sovereignty in your life back and let this back injury just be a part of your path instead of something that sticks you into a hole. So stick around, check it out, like and subscribe, and follow us for more. All right. Let's get a little taller box for you, Jimbo. Jimbo's struggling with a little back strain. Got a little tweak. So we're gonna work on that a little bit this morning. Remember these? Right here. Just gonna work on lifting. Just want to work on. See, I'm lifting this side. Step back. Make sure the foot's not moving without that. Up a little higher. There you go. So you're trying to lift right here, right there. There you go. And back. Back. Don't try to overstretch. Just control what you got. Yeah. Right there, and that's it. Now find your breath. You see how your foot lifted first? Yeah. Now lift the foot. Perfect. Good. Let's see the other side now. Lift this first. There you go. That side's a little lazier. Yeah. So really just kind of here, there, and back. Up. Yep. And now what we'll do, just to make sure the hip is moving in the right plane. So I got something here, Jim, that you're gonna just make sure you get your leg over it once you go lift, but don't lift until you get that pelvis on the right side lifted. And then out over it, yep. And back. Hike and over. Point of this is like you're really thinking about when you have back injuries or you have pain in general or something that's inflamed, you're going to start to move in a more primitive way. Your body just goes into a weird protective mode. So the biggest key is we're trying to make sure we're sequencing movement that's also therapeutic because we're getting extension, rotation, which is kind of the opposite of how we hurt our backs. It's usually a flexion and rotation. So now he's just working on sequencing the core to move first, which means the trunk is reacting and then the limbs can react off of the trunk. So he's getting the central movement first and then the foot. You see how the foot kind of wanted to go early there? Let's slow down the leg. Keep this down. And let's get that full position here first. And now bring the foot. Perfect. And so when we can sequence motion here, we find that we're more efficient once we go back into our default settings. So we're actually moving in a way where we're not moving the foot before we engage the spine. We always have to move the limbs on a stable trunk. So this is about thinking about when you're he actually was seized up last night, and this is how we're engaging. We're really trying to make sure we're getting the movement progression and the way the sequencing works. That's how the body can efficiently use momentum to move properly. So that's the stuff that we want to remind it of right away. All right, so now let's just think about just the straight kickbacks where you're just going to kick back but not with back extension. So you're almost going to pull everything in and then start to lift the foot from there. No, you're still going to let this support so this is basically supporting my spine. And then just this position is like a traction. So my lower back just popped just because it's a separation. So it's kind of allowing it to pull apart, right? And so now you're kind of playing with the core control in a different way because you can feel it different. So now when I exhale, I'm actually going to feel like the front of my body engage, my abs, and then lift off of that. And you're trying to resist the urge to see the extension through the lower back. You're almost trying to pin down and elongate the lower back and then lift with the glute. And then turn off the glute, turn off the back. You're trying to resist getting all that extension through your lower back, and you're going to put that extension into your butt, your glute muscle. Yep, and then just go as high as you can with your glute. And release. And just take note of how much your lower back's wanting to do, if anything. But it's going to show you that the restriction on the front of your hip is making the glute have to work twice as hard. There we go. So he's trying to take the stress off of here and put it into here. There we go. So he's not getting this huge squeeze here. And then what happens when somebody has a really hyper dominant extension tone in their lower back, the glute's not doing enough. It's almost like it's doing as much as it needs to, but it's being dominated and overpowered by the extension here. And then also all this extension here is going to deactivate our core. It's deactivating that anterior chain, the ability to control the rib to the front of the pelvis. On this last one, go ahead and come up. All right, do one more here. Now that we've gotten a little tired. And then now come down. There you go. And as you breathe, you're just going to focus on manipulating almost like that pelvic tilt position, like you're just trying to drive the hip forward through exhalation, hollow out through exhalation, push the knee down, and then when you inhale, relax. When you exhale, put pressure into that foam roller, not the foot, just the knee. Leave the foot alone, don't let the knee shake. Yeah. So you're letting this stay bent, and just drive pressure down into the roller, and then when you inhale, let it go. Don't let the foot straighten. Perfect. So this would be, he's elongated that whole anterior chain through the hip flexor, and now he's just going to do some contract relax here. So while we got some length here, he's driving into that restriction. Turn the glute on, turn the glute on, turn the glute on. Yeah, there it is. Feel the difference? It's like you're pushing the hip socket forward into the block. Perfect, perfect, perfect. And relax. So it's almost like an active opening. So the best way to stretch the lower back is to pull everything in from the front, and now we're getting this extension and elongation, but it's through engagement instead of something passive, so his body knows how to retain that gain. Nice. All right, let's try the other side. Just same procedure. There you go. You know, knees maybe keep the knee more straight. Yeah. There we go. Nice. So he's moving as fast as his breath allows. So essentially he's not trying to overpower and control the breath. He's trying to breathe and then find where his movement fits into that breath sequence. It's a different mentality. A lot of times we're trying to breathe and put the breath into a box that we control, but we're losing something without even realizing it. So it's like there's a hidden key there. And you can see from the side how he's basically getting the whole anterior front line engaged, which is allowing the posterior chain to elongate. but just through a compressive load to that exhalation. And now he's using reciprocal inhibition to send signals to the lower back through muscle contraction that will inhibit and relax the lower back. But it's through the antagonist, the other side of the body, taking on more of that load. And then essentially now it's going to take, it's almost like the body trusts itself more, therefore it allows some of that tone, that tension to absolve, to relax. I just want to work on that big position, up, and then kind of pin, block, and back. So you got to get high enough that you can almost, you're trying to get to where you can almost like get your thigh to your chest almost, and then let it down. Pin it, there you go. And then down. Maybe bring it in a little tighter. Yeah. Boom. And yeah, lean on that knee. Yeah. Did you feel anything in your back there?
It's restricting me.
Yeah.
You know, I'm getting higher and higher. I was not expecting to get stuck right there.
Yeah.
You know what I'm saying? Like, I was expecting to put my knee up against the wall like normal, and it's just tough.
Yeah.
But we're getting there.
But it's showing you that's essentially that elongation.
Yeah.
And that's really the idea, is the higher, more you can almost get it to a point where you can get it stuck.
Yeah.
And then you can kind of rest for a second and like close this distance, you know.
Would it hurt me to roll it out on the...
No. And actually, let's start here and just polish up with the kind of therapeutic stuff. So just lay flat on your belly. And this is really kind of where most people would start, honestly. But Jim's a little bit more advanced student here. So let's just work on a basic prone press up. So roll, maybe start with the elbows kind of right under you. Essentially, you're just creating a frame. So if you do have a back injury, especially if it's radiating into your hip, you're getting some sciatica, this is where you kind of need to start. Just building tolerance to just framing, creating a structure here, and then just literally just breathing and letting gravity and the pressure move through you through extension. And obviously I like the idea too of when he's inhaling, he's actually trying to bring this up, almost like he's trying to stretch his spine out, and when he exhales, he's trying to just maintain some of that. Feel the difference? So essentially, this is where you would kind of want to start. Maybe just building tolerance to this position for a couple minutes. And you'll notice that if you do have radiating pain, it'll start to centralize. And the goal is you actually want to really get to where now we're getting the pain centralized, even if it's actually feeling a little worse here in the center, but it's actually coming out of the glute and it's moving to the center of the body. That's what you want. Because now we know that we're actually centralizing the disc, and we're taking pressure off that nerve root. And so he might also want to alternate. Maybe he wants to flatten himself out for a bit, let everything lengthen, and then he can kind of come back and forth between 1-2 minute intervals there. And then obviously the next thing here was, so we just want to do a standard press up. So now he's just going to take that same position he was in, the elbows under the body, and now he's going to work on getting full straight position, full breath, and let it out lower, unfold. And he's practicing kind of dropping his spine back to the floor like you're dropping a set of beads downward. So like if I had a string of pearls and I were to lift up one side, I'm going to set down one pearl at a time until I get down to the end. So just setting it down like one bead at a time, one bead at a time. He's going to lift it one bead at a time from the top. And feel how his spine is lifting segmentally. And you got to think almost all back injuries occur due to we stay in this forward flex, forward fold action. It's a part of our lives. It's where we operate. So believe it or not, a lot of the ways we create balance in the body is just reversing. It's just reversing the pressure, reversing the dynamics using that reverse engineering principles, right? If you're doing this at home, you want to break it into sets. And then also work with your tolerance. If you get to a point where you're just like really getting sore, or you feel like it's kind of getting aggravated, then the goal, it doesn't though, right? The goal would be now just to break up that extension pressure and just roll on your back, just roll over on your back. So now, maybe while I'm resting, I'm going to work on just bending the knees here and just feeling like I'm actually flattening and allowing the lower back to sit into the floor. So you're just taking some of that extension pressure off the body and letting it move there, but you're not letting it move into flexion without a little activation from the deep core and the breath. Yep. And then now if you lift his arms up towards me, you'll notice this can drive downward as this goes upward. So you see that section of the body engage, and now relax. Go up and maybe stretch out. Elongate. The ribs come back up, and he's going to exhale. He's going to hollow, and then he's going to drop those ribs down with a nice little engage here. And so he's just kind of tying the front of the body in. Again, we're using reciprocal inhibition. The more we can add energy into this system, the more we're turning the volume down, and we're turning the tone down on this posterior system. But it's all through the ability to control the trunk, the ribs. This is one huge compressive vessel. So as he blows air out his body, blow, 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 everything gets smaller and more contained and more compressed. And then when he inhales through his nose, everything can now expand and elongate passively. So he's creating rebound tension through compression. And then now when he just opens his nose, the body refills and unfolds. Good. And then once you find that little shake, that's where you know you're making some real progress there. And normally it's going to be in this section of the body, kind of that mid-thoracic area that gets ignored. Good. All right, back on your belly. All right, so now we're going to do the same extension. And then now once you get to the top, we're going to work on that same thing it did earlier. We're just going to kind of put pressure through one hand, put pressure through the other. And you notice how the big shift when you went that way, that's the one you want to be more cognizant of, right? Now down, lower, all the way to the floor, all the way to the floor. Unfold, deep breath, elongate, and extend, push up. Good, slowly lift. See how there's no motion there? That's what you want when you do this other side. Yep, good, and release. See how it's like very stable when you do that side? Try to create that same feeling of stability. Yeah. Good. Now you're finding that's the appropriate amount of motion. The first rep, it was that big shift, that big wonky shift. That's what you're working on. But you're seeing how that left shoulder weakness is basically your lower back has had, and pelvis have had to adapt because of the shoulders. So we're making progress on the lower back by actually getting the shoulder reconnected to that system in a healthy way. And so let's try it again. And I want you to see if we notice what we're looking for is just movement and his adjustment as he's putting weight through one hand. So see almost no motion, no. Everything stays connected, and see that shift, that's okay. That's half of what it was. And then we're playing on reducing where we get these big clunky shifts here in the middle. And a lot of that is improving the dynamics of how the pelvis and the shoulders are actually talking. This is how the body works and function in life. And he's working on basically the shoulders connection to the opposite hip when he's doing these. So you notice when he lifts this, that knee buries down. When he lifts this knee buries down to give stability. Now he's getting more length. That looks great. So now it's uniform. So we're in this uniform, equal shift. And then the next time he starts, it might kind of go back. So each time, it's just like claw. It's like it starts off with no context. You got to kind of remind it sometimes. And then eventually everything kind of falls in line. All right, so the last one, and this is if you're really having difficulty with some of these press up positions. When Jim's done here, he's just going to flatten out. And now you're thinking about trying to maintain all this length as you can through here. You're going to pull your toes up. And then as you exhale, all I really want you to do is work on pushing the knees up. Feel that pressure, 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 and now relax. And so we're actually getting extension through the lower half, but it's really just through him tightening his legs, engaging the glutes, and then you'll notice the lower back actually stretches out. So inhale, exhale, and glutes, boom. And then now we actually get this, so we're not getting, almost like we're teaching the spine not to have to overreact and extend. So when he engages those glutes, the back can now maintain that neutral elongation. And all he's really doing is like quad sets here, but he's pinning, he's getting the toe up in the highest position possible, and he's just working on kind of pushing his knees back and creating a lot of tension through this posterior chain, finishing with the glutes, and that's going to pull that pelvis down at the end and allow that back to elongate. And if it's not, that means we're kind of still stuck in that hyperextension. That's good. So now I want you to feel that same feeling where you get that same position but just on one leg. Yeah, where you get it nice and straight to the point that that glute engages, and then now lift the heel and relax. And now do that on the other side. Straighten the leg and then boom and relax. And so what I'm always paying attention to is how the spine's connection to the pelvis is reacting to this sequence. You can almost think of like these chronic dysfunctions, especially when it comes to frozen shoulders and stuff people have learned to live with for years and years and years. When they get wired deeply into the autonomic nervous system, it's interesting because it's like a child that's been helicoptered in a way. It's like the response there is normally a kid that goes off to college and goes to the bar every night and gets in fights and drops and makes horrible grades and drops, like, you know what I mean? Like it's like all that extra nurturing actually turned out to be a really bad outcome, you know? And so sometimes when we get into these chronic phases, a lot of the work is actually trying to divert the attention away from the alarm systems and trying to confront the dysfunction in a way where you're not running from it, you're confronting it. How you feel? He's exhausted. And why is he so tired? It's because this is all neurological. This is high levels of neurologic stress that's very energy consuming, you know? Yeah. But also like how he feels now, his blood pressure's lowered, his general hormonal balance, his dopamine, his serotonin, his endorphins are skyrocketing. He has no pain to speak of because it's just impossible. The physiology at some point, and also your breathing itself is increasing your pH. So once we get to a pH that's over about 7.2 is average, so once you get about 7.4, and with just efficient oxygenation and movement, you're almost overriding the threshold of pain, and so you're improving your entire physiological state. You know, how you feel, Jim?
All of the above. Gonna have a good day, man.
Yes, sir. Yes, sir. Can you touch your toes? Oh yeah, that's good. Nice.